Hey there, and welcome to our channel. Today we are going to understand deeply over the medication Cetirizine, second generation potent histamine H1 antagonist, piperazine derivative, carboxylated metabolite of hydroxyzine, low potential for interaction with drugs metabolized by the hepatic cytochrome P450 system, more effective than other H1 receptor antagonists at inhibiting histamine-induced wheal and flare responses. Tolerated by adults, adolescents and children with symptoms of seasonal allergic rheumatoid arthritis (SAR), perennial allergic rhinitis (PAR), and chronic idiopathic uteric enteritis (CIU). Effective dosage of ebastine in SAR, PAR, CIU, fexofenadine in SAR, loratadine in SAR, CIU, and misolastin in SAR. Effective in reducing symptoms of allergic asthma in adults. Reduce the risk of developing asthma in infants with atopic dermatitis averse to grass pollen or house dust mite allergens. Pharmacodynamic profile. The carboxylic acid metabolite cetirizine exists as a zwitterion. This may be one of the reasons for its high H2 binding, poor biotransformation, low to moderate lipophilic activity and poor blood-brain barrier, low affinity for adrenergic and serotoninergic receptors. Oral cetirizine 10 mg inhibited histamine-induced wheal and flare responses in non-atopic and atopic adults and pediatric patients. It worked for 48 hours and lasted for at least a day and a half. Not associated with adverse cardiac effects. Pharmacokinetic profile. Cetirizine oral is absorbed in the gut at a dose-dependent rate, reaching peak plasma concentrations in about 1 to 2 hours. Plasma concentrations reach steady state after 2 days and stabilize after 2 weeks. With no clinically significant drug buildup after 2 weeks of oral 10 mg once daily dosing. Approximately 90% of the drug is bound to plasma proteins, mainly albumin. It has been observed that oral cetirizine is rapidly excreted in tear fluid in individuals suffering from allergies, and has also been excreted in breast milk. The metabolism of cetirizine is minimal, and 70% of the dose is eliminated in the urine, with 10% remaining in the feces. A small amount of a metabolite that undergoes O-dealkylation was found in plasma and stool, and 2 other unidentified metabolites were found in urine. After a single oral dose of 10 mg, T1/2 beta half-life is 6.7–8.6 H in healthy adults. Since cetirizine is only slightly metabolized by the liver, it doesn't have a lot of potential for drug interactions. Cetirizine co-administration with cimetidine, theophylline or macrolide did not have clinically significant impact on cetirizine pharmacokinetics or co-administered agent. Therapeutic use. In adults, adolescents and children 2 to 12 years of age with seasonal allergic rhinitis (SAR), 5 or 10 mg once daily was shown to be at least as effective as placebo in terms of improvements in TSS, total symptom severity, scores and global efficacy assessments. In SAR, cetirizine and montelukast were comparable in terms of both objective and subjective treatment response to topical corticosteroids such as budesonide and mometasone in 2 small, one-sided, placebo-controlled crossover studies. In a small number of studies, cetirizine has been linked to a decrease in overall atopic dermatitis symptoms in adults, adolescents and children. Cetirizine was shown to be significantly more effective at sparing corticosteroids compared to placebo in infants with moderate atopic dermatitis when administered twice daily at a dose of 0.25 mg per kilogram. The results of a limited amount of small-scale studies indicate that cetirizine attenuates local mosquito bite reactions and decreases the severity and frequency of allergic rhinitis in pediatric rhinitis patients. Dosage and administration. Cetirizine is a medication that can be taken orally, either as a syrup or as a tablet. You can take it without having to eat. The amount you should take depends on your age and if you have any problems with your kidneys or liver. Pregnant women should only take it if it's clearly indicated. Tolerability. In placebo-controlled clinical trials in adults, adverse reactions associated with cetirizine greater than 10 mg per day included somnolence at 14%, fatigue at 6%, dry mouth at 5%, pharyngitis at 2%, and dizziness at 2%. Adverse reactions in placebo recipients were less than or equal to 6%. Adverse reactions due to discontinuation were similar in patients receiving 5 mg per day, 10 mg per day, or placebo. Cetirizine was well tolerated in 5 or 10 mg daily in placebo-controlled pediatric studies 6 months to 11 years of age. Cetirizine was not clinically toxic to the central nervous system (CNS) or the cardiovascular system (CV), although the average daily dose was greater than 4 times the recommended daily dose. It's been shown to be effective in treating SA, PA, and CIU symptoms. It also showed that it can help reduce the risk of asthma in atopic dermatitis susceptible babies. It was also effective in treating allergic coughs and mosquito bites. But it has a good ENT profile and it works quickly, so it's a great option for a lot of allergic conditions. Thanks for watching our video. For more, please do like, share and subscribe and hit the notification bell for latest updates.